Good morning, ladies and gentlemen. Welcome. Dawson County Board of Commissioners budget meetings. Appreciate everybody that's watching us online as well. As you can, for everyone is here, so all 5 commissioners are here for the record as we get started into these budget hearing process. Today, we'll start out with our HR department, Mr. Brad Gould, who's our HR director. And I'll just kind of bring the board up to date on what HR is asking for. If you look at their budget, the request is $187 less than what the 2020 actual budget was. There was some increases and decreases in some various line items such as group insurance and a decrease in advertising that kind of balanced themselves out. The one thing that Brad is asking for that wasn't in the 2020, and I'll let him explain it to you, is a position control module. And that's a $2,000 item. And also he is asking for a rate increase for his HR specialist risk manager, and that totals $2,685.19. That's salary and benefits, and that's on a separate sheet as you have. That'll be on the sheet that is for position requests and changes to the personnel that we currently have separate from his budget request. Brad.
Good morning, Mr. Chairman, Commissioners. Thank you for having me. The first $2,000 is change our position control. Currently, it's done through an Excel spreadsheet. It's very cumbersome. We used it for probably 7-8 years here in the county. We make changes. We have to make changes not only to position control, but to our CSI program, which is a program we use for monitoring salaries, position, people, that sort of thing, deductions. And that CSI program does have a module for position control. So I've been looking at that, working with the Section Harris computer that maintains that for us, provides us service. And I've been working with their IT programmers to try and take a look at position control to see if it will, in fact, save us time, get a cleaner copy, but at the same time, it needs to provide the reports to our end users. That's we're just trying to streamline our processes to make it more efficient. And right now, we're still kind of in that fact-finding phase to make what we need. That's why I'm asking for that.
I can.
Thank you.
I wasn't gonna forget that. Do I have to start over?
No,
Okay,
you're
good. So my second request is a personal change request for our human resources specialist / risk management. This position not only does the human resource specialist functions, and we're all really generalists. We all do a little bit of everything. But with that position, risk management is huge. In the long term or short term, it saves the county money in our premiums for liability, workman's comp, our property and casualty insurance. It's currently filled by Christie. I feel when they looked at the salary study, they really didn't look at that part of the budget. So I went back and did some analysis of surrounding areas. And I thought a fair increase would be the $2,383.66, and then there's taxes and retirement that go into that for a total of $2,685.19. But some of that work that she does, she was on vacation last week. She came in today, opened her mail, and there's a $6,000 check that comes back to the county for her safety programs. And that's only one example. She's got about 6 different grants or programs that she manages. She's done a great job, is very conscientious of it. As you know, she's looking at the DC Wellness Program now. We've got some activity on that, and that's moving forward. But all that is designed to reduce our liability, our exposure, and ultimately our expenses. Some other things she's done. She does the annual health and wellness fair. We usually get about 20 vendors to participate. This year we weren't able to do it, but she just passed out the safety bags. And some of that stuff was donated. She had to purchase some of that as well. She does the annual flu clinic that we had last week. She's bought a washer and dryer for the EMS turnout gear through these programs, non-skid mats for the senior center, first aid kits for buildings and vehicles, safety gear for public works. And I know not too long ago, she put a request out to all the departments for their safety requests. She's purchased AED and provided CPR and AEDE training and certification, as well as ergonomic workstations for some of the administrative staff. I feel bringing her salary up to this point would be definitely in line with she does for the county, and would make it more competitive with what's out there in the workforce. Any questions?
Questions for Brad?
You guys were obviously intimately involved in the salary study, and my comments are in no way, no means of Christy and the performance that she does in her job. But my concern is, as we start questioning salary study numbers and the validity of the salary study, then that opens Pandora's box for every single department that we have. Specifically, since the salary study data was collected and y'all had the input into that, into the job roles and responsibilities, I know that one thing that has been new and added to her plate since then would be the wellness program. And we decided to not go full blown on the 40 grand or whatever it was through a third party, but she was going to handle it in house. So that's something that she's added to her plate since the salary study. Is that a fair statement?
Yes, it is.
Okay. How much time, I mean, that's what all is involved in her implementing that? I mean, if we just look at that component.
But initially, it was quite a bit of time. And then once you get the program going, it's just a matter of maintaining it, communicating it. She sends out monthly emails. When folks have something done, they get the flu shot or they get a physical. She's got to process that and, do the paperwork to credit, to make sure folks get credit for that particular benefit that they're looking for, to get something back for the wellness program. In as far as a salary study, I mean, I've been able to take a solid look at the risk management portion of it. And that's the main reason for that increase, because when you look at what risk managers are making out there, she's still somewhat below. She's doing two jobs too. She's doing more than just the HR specialist. She's doing the risk management specialist. And that's what I'm looking at.
That wasn't communicated when the salary study feedback was requested.
As far as I can tell, I don't think it was.
But on the day we discussed that, she agreed that she could do it, when we were talking about cutting the funds. And she felt like she could do that additional job. Another question I have, you talked about grants. Does she get any assistance from our finance department? Don't we have a person that just does grants?
The accounting and reporting side of it.
Uh-huh.
Chrissy kind of does the program side of it. We do the financial side of it. She does the program side of it.
She works directly with ACCG, Anthem, and anybody else. I mean, she's making the calls to, I believe, Health South for the blood mobile or for flu shots. But like Vicki said, yeah, she's the program side of it. She's making it happen. She's walking the county with ACCG's property and casualty representative. That might not be the right title, but Steve Shields. She's making those calls, working with our our folks with workman comp issues to try and get people back to work as soon as possible.
Okay, now, how many people do you have in that department?
We've got 3.
3. And how long have you had 3?
It's just been a little bit over a year with one of them out on long-term disability for about 6 months now.
And so we haven't increased that many in employees. And for so many years, 2 people did everything in there,
Sure, I can't speak before my time,
right?
but human resources is changing. It's more of we're in a more litigious environment. Not only do you have ADA, labor laws, you've also got the COVID now. And I use that as an example because since I've been in human resources, it's changed quite a bit. So it's always growing. We keep very busy, and I think we do a good job with some of the tools we have. We have a lot of tools out there that we do use. I mentioned the CSI program. I think that could just be a great tool for us. We're also looking at other things, long-term that you can't do overnight, but just will take some time to implement.
I know with this year, you haven't been able to go to those classes because you say it's always changing. I would encourage you to always, when things do get better and you can get in those classes, so, you're staying up to date and everything.
Right. One of the things we do have is through the education, we're all members of Richard Pryor Learning Systems, and it's strictly what we use is the HR side of it. So we're able to take those 30-minute classes or those all-day classes. And as you said, we're not able to go to them, but they have them online now. And that's kind of how we, along with being members of SHRM and some of the things that Christy is doing through GLGPA, keep abreast of changes in human resources.
That's great, good.
Other questions for Brad?
And I think we need to remember too that I know the pay studies in the past, we've done them in phases, but we've never completed all the phases. And once we approved the pay study and didn't complete all the phases, we were behind again. This is a history of the county doing that. We've paid for these pay studies and we've never completed them. And once we approve them and try to complete them, we're back and behind again, just like we are now. A lot of these surrounding counties, their budgets were approved June or July, and once we approved ours, we were behind. So I think the study, we didn't complete what we paid for, and that's the reason we're right back where we're at. I think you're going to see that from other departments too.
And when I look at this request, it's not a classification change. It's not a rate change. She's still within her rate. I don't even think it may bring her to just below mid-level. So she'll still have room for growth in there. And it also eliminates any wage compression we could have between her position and another
And
position.
that's the question that I had for you is, I know we have, if I remember correctly, that when you presented in July, we had about 101 employees, I believe it was, that weren't at the 105% level of the 300 something that we have that are full-time. Does this employee fall in that category of not being at the 105% level?
No.
Okay.
In fact, if that's implemented, she won't see, that position won't see an increase.
I think it's one of the things that I think is critical as we look at salaries and different things associated across the board is that we've got to get everybody on the same sheet of music first, where we don't have 100 people right now that are not at 105% and we have 200 something that are. So I think that's important for us to remember as we look forward, and we'll talk more about that as we get into the other pieces of the budget. But yeah, I understand what you're saying, but there's issues that we have to address, I believe, to make sure that we've got all of our full-time staff where they should be to begin with. Okay, any other questions for Brad?
I mean, on the grants, she's going out and getting grants. I think grants with the finance, they're just making sure that the paperwork's right.
Right.
We're getting collected and turned into paperwork to cover what we've spent out. But she has to actually go out and get the grants, which our grant person doesn't do that, do they? They don't go out.
No.
Okay.
Do the accounting.
Counting.
report
Yeah.
side.
And I think going back to what Tim brought up is also important for us to understand as well. We've done multiple salary studies over the years. And I don't really know of one that we've actually followed. And a lot of that's always associated with the dollars, of course. Everything's associated with how much money you have to spend.
Agree.
Every year, that salary study that they give you, far as longevity, has an increase that's associated with it. And that's the part that the board never has actually followed. Now, the board over the years has done things such as 2% pay increases and different things like that. But if you look at the breakdown, a lot of times that longevity might be 2.6% or whatever that salary study guru figured that to be going forward. And that's where we wind up getting behind. And then the last two salary studies that this board has dealt with, where you see yourself $1 million in the hole after you went 2 or 3 or 4 or 5 years and you didn't do some of that stuff. But it also goes back to how big is the pie? You know, what's the total dollar amount that you have in the pie, and taking a look at that right there. And that's something that we'll take even more look at throughout this process, because it is important to stay competitive in the job market. It's important for us to maintain as much of the staff that we have as possible, because anybody that's ever done any kind of business work at all understands that recruitment and replacement and retraining of people is not a very cost-effective way of doing business. And that costs you money and time, and a lot of things that you can't even put a dollar mark on that's associated with that during that downtime. So we got to take serious looks at that. We've got to see exactly what our revenue will allow us to do, and prioritize these things as we go forward. Any other questions for Brad?
I want to ask the person on long-term disability, is she still on, is she working or not?
No, no, ma'am.
She is not working.
No, ma'am. We hope to have her come back in a couple weeks.
Okay. Okay. All right. Is Christy picking up the slack on that?
No, we both are. Yes.
both are?
Yeah.
And she has been out 6 months?
Approximately, yes, ma'am.
Yeah. How long can, I'm just curious, how long can that go on? Say if she's not able to come back, how long can somebody stay out on long-term disability?
By law, you have FMLA, which is 12 weeks. And then the county doesn't have a policy for unpaid leave. It's kind of vague. It's up to the director or the department head. We extended it. You know, we want people to get better. They have a certain skill set. We want them to come back to work. But I think after a while, you have to start to look at it and say, okay, how can we function as a department? What are we losing? How long can we maintain this? And the other thing we have to look at too is what we do. We need to be consistent from department to department to
Yes.
department. Otherwise, that could open up other
Pandora's
things for
box,
us.
as it
Exactly.
says. Mhm.
Yeah, and I think we're moving there, not only from my department, but the support from the county manager when we look at cases like that. So I hope that answers
So
your.
you think
your-
she will be able to return, but you crossed it?
Yeah, I've been in close contact with her and hoping she can come back the 19th. But that's a
Don't really
discussion.
know. You're not really sure she will.
Right.
Any other questions for Brad? Thanks, Brad.
Thank you.
All right, next scheduled is fleet maintenance, and that's at 9:30, so you have a few minutes to look that over.
I understand all this medical leave stuff, but I still say, hey, you fuck with me, somebody say, that would have to be hard.
Here's one, you know, how much it costs to fix it, it might cost more than vehicle. Thinking over what's got it, we gave them a opinion, Ford Escape. And that's the maintenance on it. That's the maintenance on it, it's just 12 years old.
You do in yonder, in the copy room, you can make it a quick copy. In the copy room, you can make yourself a quick one.
Kristen, do we have coffee somewhere?
Yeah.
In this one? This one? I'll
You
get
gotta
it.
put the water in there with the cup and
Do what?
you pour the water in there with a cup, little cup back there.
In that one?
Uh, Most of them are, yeah, 12 years old. but
You did what? What? You know, I don't understand most of it. But I feel that you still don't do the best work. When you're under the gun like that, and you just cannot, there's so much stress, because you start something and then something else. I mean, no, it's not, You end up with gaps and mistakes, and it's the only reason I'm saying that is just so much that I had to do and do the hard, and then we had to take classes, and then I did that and I would try and do this. Because I was my baby, and I was like, well, and then I go back and but that all restricts so thin. Like they see, I don't even, I know, it's not good, and I'm telling you, you do make more mistakes. That's just the fact, that's just life. It is, And then, I mean, you eliminate that. And then somebody else comes in. I feel, I know, I'm good. Oh, Lord, yes, it's pretty much true. Yes, I always say that everybody is a piece of the puzzle. And when one piece is gone, I'm telling you, it's tough. Hold on a minute. Oh,
Yeah, what's the point of drinking coffee without?
I knew you were gonna say that. I knew that was coming.
He's not hyper.
No, he needs revving up.
I understand the point. You don't have coffee. or
I
caffeine.
know. Listen.
I drink coffee, but I drink my iced tea.
So do you think like caffeine?
Oh, yeah.
I started doing, I was reading this, or listening to this audiobook about how to have high performance day, just pick one day at a time. This guy really talks about, you start with at least 12 ounces of water with a pinch of sugar and lemon. So I drink more than that. I drink a ton of water every day. But I started with that before I do a coffee.
What could you tell any difference?
That I've only done. Might change next week.
But what that is, that's hydration.
Yeah.
That's what that is.
I mean, I don't feel like Superman or nothing.
You ain't jumping no fences.
I feel that with the caffeine.
Yeah. Wait till you get 70. I don't know if I'll make it that long. Hopefully I will. Lord only knows whether I will or not. Medicare. There you go. All right. We ready?
Yeah.
All right. Let's continue. Shannon's here with Fleet Services. He's the next person on our list and budget process. Shannon manages our fuel facility, as you're familiar with, as well as our Fleet Services Department. And Shannon also is the person who makes a recommendation to you in reference to our vehicle replacement list, because he is our professional guru in that particular category, and we will be discussing that with him as well as part of his presentation. He's provided y'all with that information. Shannon will start out with the fuel facility.
Yes, sir.
And in the fuel facility, Shannon had made a request of about $1,500 of additional revenue, and $500 of that was in property repair and maintenance, and there was also an increased request in reference to the diesel fuel additive of about $500. Is that correct?
Yes, sir.
As well in that as well. And so those are pretty much the changes that are associated with what he is requested in the fuel facility. And if you'll just kind of go over those, Shannon, for the board, that would be great.
Yes, sir. We were asking for an additional monies for the diesel fuel treatment because the price is going up, but that is an important product that we need. It helps boost the cetane and keep the diesel fuel at a good level, keeps it treated, keeps the microbiologic growth out, which is a real problem nowadays in your diesel tanks. And that's,
Is that added to the, do you have to add that on each tank, or is it added to the actual fuel? So when they pump up, it's already in there?
yeah, it's already in, we actually pour it in the ground. Yeah, typically when they bring a load, so it mixes it up good with the fuel. And we were asking for additional monies for property repairs and maintenance. Because of the new building, we've seen some additional expenses with the larger building. And we were asking for a little extra to help cover those throughout the year.
And then a little bit about your general supplies and materials.
Well, that was another issue that we've come up with in the larger building. It's just kind of help to fill in the gaps and stuff of some of the more supplies and materials that we need.
Okay. Questions for Shannon in reference to the fuel facility?
What's the total additional amount?
1,500 from his 2020 budget, yes. It was 14,198, 15,698. Any questions for him? Now, we'll move on to fleet services. And as you look at fleet services, you will see ups and downs in the budget process that he has there. And some of that is in salary and benefits. You'll see actual numbers that have been provided by our finance department. See an increase in group insurance, which is something that the board obviously has approved. The salary is also approved by the board. One of the increases that Shannon has asked for is in outsourced repairs, approximately $5,000 there. And also, one of the things that you'll see that was in the 2020 budget that's not in the 2021 budget are the building, the stuff at Fleet Facility. That was some equipment we bought for him last year to finish out his building. He didn't have to have that in this year's budget. That was a one-time purchase. And some machinery costs that are also not in his budget. And then down at the very last thing there, the depreciation of $10,000 that's been added to that. And that's an annual thing, I guess, that we have to do. And so Shannon, not knowing what that is, he didn't put a number in there, and that's something that we take care of. So if you look at the overall, his request was about $34,000 less than what he had been given in 2020. But if you look at the recommended and look at that $10,000 that we have to put in there for depreciation, it's somewhere in the neighborhood of about $25,000, still under what he was given in 2020. So Shannon, if you will just explain a little bit about the outsourced repairs.
We were asking for a little additional monies in that because we see some of our equipment that's getting older and the outsourced repairs, and we had reduced the outsourced budget due to some new equipment over the last couple of years, but we have some older equipment and we're more or less just trying to get ahead of the curve. So we're not short on money.
And I know you've made some progress in that, obviously, because in 2019, you only spent $27,000
Yes.
in outsourced repair. And I know the new equipment that's allowed you to be able to do some in-house stuff is helping you with that as well.
Yes, sir.
And so that's good. Does anybody have any questions for Shannon in reference to the fleet services budget?
Look, I mean, just overall, we had the 38,180 as a one-time thing last year. So just for information purposes, if you take that out, you're technically up 13,000, which is,
He's actually down.
What are you talking about?
well, if you go 322, 829,
Yeah, I mean, but overall, his overall budget's down.
yeah, overall it's down, but
Yeah.
we had the one-time last year, the
Right.
38,180, so
Mhm.
take that out.
Okay.
I would like to make a comment though.
Go ahead. Yeah, sure.
On behalf of Fleet and all of our staff, we really do appreciate the monies y'all give us to complete some of the things that were left out of the building. It's been a big help.
It was necessity. If you're gonna do a job, you gotta have stuff.
Yes, thank y'all.
Any
Yes,
other questions
absolutely.
for Shannon in
Shannon,
reference
how many
to the fleet?
employees? How many employees?
There's 3 of us total.
3.
Yes, myself, Scott Reese, and Kara Wilkins.
Okay, so you still don't have another additional mechanic like?
No, ma'am.
Any other questions for Shannon? All right, Shannon, let's move on to the vehicle list. Shannon provided you a list of 21 vehicles total that are outside our policy.
Correct.
And then he also provided you a priority 1 and a priority 2 list of 8 vehicles that priority 1 being critical vehicles that needed to be replaced sooner than later, and priority 2 vehicles that needed to be replaced as soon as possible. Now, the 3 priority 1 vehicles, one is a fire department vehicle, 2007 Ford Expedition, a roads department vehicle, a 2007 2500 HD Chevrolet, and a 2007 district attorney vehicle, a Crown Vic. And you will also see Shannon has made a recommendation of the type of vehicle to replace those with. And the cost for those 3 vehicles is $102,500. And obviously those are things that we'll look at in the capital budget. And the ability that we may have to take care of some of that based on some land sale and different things if those go through, and provide us with some one-time cash to use on some one-time purchases. And if you'll look at you tally up all 8 of the priority 1 and 2 vehicles, you're looking at $312,000. Now I know you'll see on there that Shannon had a number of $174,000. I'm guessing that's with equipment that some of these vehicles would have to have.
Yes, we are allowing for equipment, yes.
Okay. And that was for the 3 priority vehicles, that 174 number?
Yes, sir.
Okay.
No, excuse me, the priority 1 vehicles total $102,500.
So the 174.5, what's that number for?
That is all of the priority 1 and 2 vehicles together, I believe.
Well, no, that
No,
adds up
I'm
to
sorry.
312.
Yes, I'm sorry, I got my notes backwards. Yes, 174.5 is the priority 1.
Yeah, okay. And that's with the needed equipment that they would have to have,
Yes,
other
Yes, sir.
than just the plain vehicle purchase.
yes, sir.
Okay? All right, so y'all have any questions in reference for Shannon in reference to the vehicle list that he's provided? And you've done a good job here providing us with the total that are outside our policy of 21, and then your priority 1, priority 2. And I think if we decide we have money to replace these, it's important that we follow his judgment, since he is, as I said, the guru in that. Questions?
What do we have in, excuse me? All right, go ahead.
I don't have any of that you're talking about.
But the only thing we have is we give
It was all sent out. He sent it to everybody. David sent it to everybody too.
Yeah, and sir, actually, the 102,500 would be all 3 of the priority 1 vehicles. That is correct.
I don't have that.
Yeah,
Like Billy was adding up off the,
It was emailed out to everybody. I know Shannon actually sent it out as well, and so did David. So, yeah, you can provide that to them, and we'll get you a copy of it so you'll have it. But because after getting the budgets, I had specifically asked David a question to find out what Shannon considered to be priority 1 and priority 2.
That's on this list. isn't
It's on there, yeah. They're all on this list, but he actually broke it down. He actually broke it down though, and sent that out later.
I didn't get that.
Well, we'll have to check with your email. Because he did email it out, I know.
Yeah, we went back and looked at some of the
Yeah.
changing characteristics of the vehicle.
We'll make sure you get a copy of that so you have it as well.
To the priority 1, actually.
We'll make sure you get a copy. We'll get you one.
Is any of that in squash?
These are. These would all be capital purchases. Other questions for Shannon?
Vicky, do we still have that vehicle fund?
We do.
What do we have left in it?
$67,000.
I think that's pretty close.
Yeah, that's what you sent me.
The 60,
Yeah, if we haven't sent anything out of it.
Yeah. The last time I asked, that's what we had.
around 67?
Mhm. Other questions for Shannon? Thank you, sir. Appreciate the good work.
Thank you all. Have a good day.
All right, let's see. You got a few minutes. If anybody needs a break before we get into emergency services, and give you a few minutes also to take a look at your information that you have in reference to them as well. Yes. It is? Okay, all right. Well, we're going to go ahead and move into the Emergency Services Department. Chief Thompson is here today with us. As you know, Chief Thompson manages the Fire Department, Emergency Medical Services, Emergency Management Agency, as well as the Fire Marshal's office as well. We'll take each one of those separately. So Chief, we'll start with the Fire Department. Just a couple of things for the board to remember. For the past 3 years, ending December 31st of this year, we've had the pleasure of a SAFER grant that's helped us fund 9 firefighter EMT positions. That runs out in December of this year. I know they're working actively trying to get them to let us keep maybe some money that wasn't spent in that grant due to the fact that we weren't able to keep those positions full the entire time. And I know have made a request there, and hopefully that request will be granted. A lot of times they are in grant purposes. They will let you keep the money because it's more paperwork for the feds to try to take it back than it would be if they just let you keep it. And so hopefully we'll get some of that. But with that being said, we will be funding 100% of those 9 positions in 2021, where in 2020 we were funding 65% of those positions. So when you look at the fire department budget and you look at the very first line item of salaries, you'll see that that is a $104,000 increase there, and that is in line with that some of that money that we're talking about right there as well. And then some of the other areas in reference to the fire department is there's reduction from the 2020 budget in group insurance, slight increase in retirement contributions, reduction in what was budgeted for workers' comp. There was a maintained request of $5,000 for official administrative. We'll have some questions about that in reference to fingerprinting services because we only spent $779 there in 19. And then also technical services, you'll see a slight increase requested there. And a slight increase requested in general supplies. And so Chief, when we get to those particular areas as well as in small equipment, there was a substantial increase request there of about $30,000. So you can explain those as well on those as well. But overall, the fire budget is approximately his request is approximately $155,000 more than it was in 2020, with a substantial portion of that being in one line item, that being in the salary line item. And he also, in a separate area, you will see that he's made a request for 6 fire personnel to go to the new fire station that are a part of the fire department budget. He also has a personnel request in reference to a 4th med unit, but we'll talk about that in the EMS section. And so, Chief, you're up.
Mr. Chairman, thank you. Commissioners, thank you. Hopefully you all have survived the remnants of Tropical Storm Delta as it pushed through over the weekend. We at Emergency Services were extremely busy, and but we've come out the other side of it. A lot of tree downs and everything. So with that, I'll jump right into it. On 3,500, 521. 100, which is the official administration. After going back and reviewing, we do concur with the recommendation of finance of the 2,000. Really, a lot of that has to do with fingerprinting of employees, drug screens and stuff. If we're having post-accident, reasonable suspicion, anything of that nature. So really, that's kind of a catch-all. I feel like we'll be safe in that. And so I concur with the recommendation of finance. I guess the next line item to move down would be telephone. That'll be 3,500, 523, 205. We requested 21,000. And really, The sole premise behind this is with Station 8, somewhat of a moving target when it comes on board as to what the phone costs are going to be. I will tell you as we go through the presentation, when you see these on telephone, electricity, we tried to use Station 7. It's the closest in square footage, similar in size, and tried to take what we pay there and really apply it to that to try to say, hey, this is what it's going to cost us next year to operate that station. So really the difference that you're looking at there is 1,600, I think it is, or maybe a touch more. But that's where that difference comes from, is really just trying to pay the bills at Station 8 when it comes on board.
In reference to that particular one, in 2019, we spent $8,390 for telephone. What changed from 19 to 20 that made such a huge difference in cost for telephone?
I would default that back to IT since we're a voice over internet phone service.
What have we spent so far in 2020? Can you tell me that in that category?
This year we have spent,
Natalie? That's fine.
so we've got about a little over 7,000 left, and that's also some of where the cell phones for the
Yeah, no,
various.
they're all in that, yeah.
Yep. So it's not just station phones, and you do have some going back and forth whenever y'all renew contracts countywide for AT&T and everything also.
Do we have,
You got the computers on the trucks now.
The MDTs.
They cost-
Yeah.
do we have fixed costs for the cost of the phones that are going in the new station? Because some of those VoIP phones can $500-600 a piece.
Correct.
So that's not included here.
It is not. It is not.
While she's looking it up, I don't see a line item for television that we recently added.
I think it's actually in there. I thought I saw it. It may be an EMS budget where I saw that added.
It's
Okay.
in one of them.
Yes. Yeah, 523,200. So yeah, it was added in there.
So far, we've spent about 10,800 year to date.
10,800 year to date.
Yes, sir.
Okay.
And that, to the chairman's point, that is a big jump. Be interesting to get with IT and find out what that change was.
I think some of it is, like I said, they went to the computers off the trucks.
Added the cards.
It added the
Yeah,
cards.
each of the
That's
MDTs in
right.
the units have an air card. So it's
Yeah.
constantly
Okay.
transmitting data.
When did we do that?
It's into 19, I think.
It was about mid-year 19.
Yeah.
Yeah, I
Yeah,
want to say September of
That's where you
19.
got the job.
Yeah.
Y'all had several put in.
Well, I think we have a total of 15, and when Engine 8 comes on, you'll be going up to 16.
Yeah.
So you'll add another subscription.
Okay.
As well. Next one on fire, go to general supplies. That's going to be 3,500, 531,100. With Station 8 coming on board, obviously general supplies is where we spend a lot of toilet paper, cleaning supplies to keep the station maintained daily. And this is just really kind of a moving target as to say, how much is it going to cost to, use paper towels, toilet paper, cleaning supplies in there, and everything.
Still
to
buying
keep
your
the
medical
station.
supplies out of that as well, right?
No, sir, that will come out of when we go to 3630.
Okay.
And it's really just $1,000 increase or request there.
You're requesting 2,000, recommended is 1,000, so you're good with that recommendation? Telling me?
So we requested 20,900. The
Mhm.
recommendation was 19,900, and we would just ask for our recommendation of 20,900.
The extra precautions we're taking for COVID stuff, has that generated additional cost on that,
Well,
on that particular line item?
If we didn't, early on when we traveled this COVID-19 2020 year, I remember coming to work and I think I sent a text message to Vicky and I says, have we looked at creating a COVID expense line item? And I think that finance got the ball rolling. And I don't know what the current monies are that we have allotted countywide for everybody. But yes, have we seen increase? Yes, because we disinfect our fire stations at least once a week. We disinfect the med units after any COVID-19 exposure. So there has been some of those costs. Obviously, we will be putting as much of those costs as we can toward the public assistance grant that we work very closely with Lori and the rest of the finance team. Hopefully, we're going to get some of that money back and everything. But again, as you know, with the feds, just because we could stand to get back 125,000, that could be 2 or 3 years down the road too. We're not the only ones asking for that piece of pie.
But that's separated out of this line. item.
We've already
We have a
got
separate
some back,
bucket.
right?
Okay.
Yeah, we've already got some back, right?
I think that's actually listed in a COVID line item
Yeah.
that we have, correct?
Okay. Any questions for the chief in reference to fire department?
Oh, I think we left out one, small equipment.
Yeah, go to that one.
Small equipment. That's going to be 3,500, 531, 600. So in that, we requested 58,000 this year. We've got about 13,000 left in there right now from this year. And our 2020 budget was roughly 24,000. Small equipment is pretty much everything that's day-to-day cost for us operating, whether we go to a fire and we lose a section of hose because it resulted from, thermal insult from the fire, whether we have SCBA cylinders, our SCBA costs to have them certified and tested, hydro tested every year. We have cylinders that will be reaching an age that they will no longer be able to be tested anymore. So we will have to begin to replace those. And just to kind of put a price tag on that, an SCBA cylinder to purchase new, that's $1,000. If we have 8 cylinders that are going out this year, that's $8,000 right out of the get-go. And this year, obviously, we put the brakes on a lot of spending. When the county manager froze pretty much non-essential spending in the early portions of COVID, we really didn't spend a whole lot to upgrade items. And unfortunately, at the fire department, things break. The men and women do a heck of a job maintaining the equipment day in and day out. But, unfortunately, the fire and emergency services, it's a tough job. And when the equipment's used, it's used in an emergency situation. And, sometimes it gets damaged to have there. So yes, we've asked for a lot there. But unfortunately, some of the cost of doing business to keep the wheels rolling on the train, it does cost. Obviously, we look at everything from grants to offset some of that stuff in there. But over the last 2 years, we've implemented a breathing apparatus replacement program. Some of that has been, we've been able to achieve that from the purchase of a land sale. The land sale that you all had, we were able to take some of that funding and make 6 air pack upgrades. But we have some air packs that are just incompatible with anything that we use in the department, which poses a major concern for me as the fire chief when I have firefighter A wearing one pack and firefighter B wearing another air pack, and they go to the same fire and one of them has an emergency. They're incompatible. And we have numerous of these across the organization. And it really is a life safety type of situation for us.
See, what I would recommend to you, Chief, is this. Provide us with a list. I'm big on breakdown. I like breakdown. So obviously you could put something in there for unknown, because there's always something that might break. You got to get some axes. You might get some hose. You got to do this. But there are certain things that, like those air tanks you're talking about, that are going to be expiring and can't be redone and have to be replaced. So I would request that you provide the board a list so that they can actually see those dollars broke down, because, and I don't, evidently you did not do that during the regular. It would be typed here because we usually asked you to provide explanation. So if you would provide that list with that as well, that would be great.
Yes,
Tim,
sir.
you had a question?
No, I was just on face pieces. I know everybody's fit tested and with the
Yeah, the annual fit
revolving
test.
door we got of people coming in and out, the new person you hire don't wear the same face piece. What are they running now, roughly?
Yep.
And you got,
Yeah, how much?
About 150 a piece.
Oh, yeah.
And each person's issued their
Get their
own
own.
face piece from,
Right.
you know, we no longer share. Many years ago, we all shared the same. And
Sanitation.
we've
It'd be
evolved
better.
from that and now, and each
Yeah.
person is issued their own face piece from a safety.
We have
standpoint.
evolved to that. Yes. Provide us that list. That would be great.
Not a problem.
Any other questions for the chief in reference to the fire department? All right, I'll stay
Are
in.
we talking about, I guess, the personnel now?
Yeah,
Is
we'll do that in a minute.
Okay.
If you want to, you can go ahead and talk about the fire personnel for the new fire station.
Okay, I think the 6 firefighter EMTs is relatively self-explanatory. We're opening up Fire Station 8 very, very soon. It's very exciting. The addition, not soon enough. Of course, weekends like this past weekend, obviously, and then the poor contractor, I think when we issued the move forward process last year, I think he had 70 plus straight days of rain. So, you know, weather's
Little
something,
behind.
but it's definitely coming along. I was out there Friday. A lot of the walls are in place. So if you get an opportunity, you know, stick your head in there. It's going to be a very nice fire station. Very excited about it. The other really exciting part is you know, from an ISO perspective and a coverage to that portion of the county. For those of you that are not familiar, we have Station 6 just outside the North Gate, and that station we have 4 people a day at. But the next closest station is headquarters, downtown Dawsonville. And it's just to have those additional men and women assigned to that station and to be able to provide a quicker response to fire and emergency medical calls for that community. It's very, very exciting for us to be able to envision that and everything. So we're pretty excited about moving forward.
Those homeowners that have been ISO 10 will be excited too when they see a
Just
reduction.
don't know how excited.
When they see a reduction in their insurance bill. So, and that's what we've talked about that, obviously, that not opening up another station without manning it. So that's the reason that he has put that in reference to the 6 people for that right there. You have any questions for him on that new fire station?
What'd you,
Adequate number of people.
That's 2 per day,
Yeah.
which is
so,
what we have at most other stations, except for the ones that have med units and they
I
have more.
thought we were special and we might need more.
well, I mean, I think at some point we need to look at that. I mean, we've got to get beyond, I mean, 95% of the people that come up here when we do a zoning or a change or subdivision or commercial buildings, you know, talks about service and public safety service. And, you know, we're running calls now with 2 people in the truck and you can't do anything with 2 people. You can't go in by yourself. The other guy's got to run the pump. I mean, we've got to eventually look at what service delivery we want to provide. We got to get beyond 1 person on the truck, 2 people on the truck. And I mean, you know, start off at 6 is great, but I wish we could do more there. I think we need to look, while we're looking at this budget is, you know, we talked about salaries and comparison around us. I mean, we got a community, not a city, not a county, but a community that's paying more for firefighters than we are. Big Canoe's paying $16 an hour and we're still paying 14 and 15.
1549 for medics and
Uh,
14.
and I'd love to see us at least go to 17 for paramedics and 15 for EMTs and quit nickel and diming it. We every time we look at a budget, we try to go up a quarter and they're going up 50 cents. We go up a dime and they go up $1. At some point, we got to look at, if we're going to keep the people and keep the quality, because the turnover is costing money to the county. We talked about face pieces, but when they're doing gear and uniforms and training, and we're training them, they're going for site or going somewhere else or going to Big Canoe.
What happens to that face piece when they leave? Is it just?
So it will, no, ma'am, it will be cleaned and
Sanitized.
and sanitized
And hope the next person
repurposed
fits it.
to a potential candidate that the face piece may fit. So,
'Cause those are measured for the face and all that as well.
and that's the same way with,
Yeah.
we do the same process, whether it's uniforms, whether it's turnout gear. With turnout gear, from the helmets to the coats to the pants to the boots, you're looking at 10 years. That's per the NFPA. After 10 years, that gear's got to be replaced. The problem is, and I can use the board example. Everybody here is different heights and everything. And so when I buy turnout gear for I didn't say it. I fell short.
When you were.
I was smart.
We did.
I was smart.
Stop short of that.
Don't try to put me on the hook. We're gonna wrap his presentation up.
Okay.
But it's one of those things where just because when we buy it, and that's $1,800 for just a coat and pants, another $200 for boots, another $200, $300 for a helmet, you're $2,300 into one person, and I don't even buy them their station uniforms. So it's an expensive business. But we try to repurpose as much of it as we can for the next candidates that come through the door.
Okay. Any other questions on the fire department? Piece of it. Staying in line, we'll go to fire marshal and prevention. And basically, you're looking at approximately a $1,500 increase request from the chief here.
Mr. Chairman, looking at the fire marshal's budget and the recommendations by finance, we will concur
Okay.
and we can put the fire marshal's office budget to rest. Unless there's any
All right.
questions.
Got questions for him in reference to the fire marshal's budget? Okay. Move on to EMS. EMS in the salary category, you'll actually see a reduction. And that's not because of a reduction in people as much as a reduction in movement of people and years of service versus whatever. Some of them, we've lost some people that had some longevity, obviously, over time. So new people don't make as much as the people that we had, but we lost that experience that went along with that as well. Chief, just a question before we get started into EMS, where you stand personnel wise right now today, as far as fire and EMS?
So right now we have 3 firefighter paramedic positions, and we just accepted a resignation of 1 firefighter EMT. Most of what we're seeing.
We have 4
Yes,
openings.
so 4 openings right now.
'Cause the other day when-
3 medics,
what?
1 EMT position.
2 weeks ago, when you and I talked, you had 2 and 2. So
Correct.
now it's 3 and 1. Still 4. Okay. All right. EMS, obviously changes make differences. Like I said, in salary, they make differences in group insurance. You'll see a small decrease there. You've seen an increase requested in reference to vehicle repairs and maintenance, and I'll let the chief talk to that in just a few minutes, of $11,000 over 2020. And if you look back at the history, you'll see we kind of have an up and down going on there in reference to vehicle maintenance. And obviously that all has to do with age of vehicles as they age. But for the remainder of his budget, you don't see, a lot of major change. You do see like some increase, like for gasoline. Obviously that due to call volume increase, and we see some call volume increase annually, which is normal as we continue to grow. He obviously had a $15,000 request in small equipment in 2020 that he doesn't have any requests this year. So that was a one-time purchase type thing, and he is asking for a little bit more money in uniforms as well. So Chief, if you'll just discuss those.
Yes, sir, Mr. Chairman. So I'll jump to 363522-201 vehicle maintenance and repair. I think if you go through Director Harbin's request from Fleet Maintenance, you'll see that there is an ambulance in there that is Med One. That's well over 150,000 miles now. For perspective point, just so you know, we are putting about 35,000 to 40,000 miles annually on these med units from the call volume. And that's up significantly. With that, you know, I remind myself last year when I was looking at my budget, we get into December, we're sitting at December. I'm thinking, okay, we're doing pretty good. We got about $20,000 in maintenance. The trucks have all held up good this year. 2 turbos went down the first week. Turbo, $7,000 a piece, $14,000 later in the month of December. And right now, I've got $5,000 to get me through from now to January 1st in that budget. So I took, hearing the chairman and saying flat, I took what we actually spent, which was in 2019, $43,938, and I requested $44,000. So really I was asking for, $62 over what we actually spent in 2019. The unfortunate thing is, the older these trucks get, the more money it costs to keep them going. And unfortunately, we got to keep them on the road. It's the cost of doing business.
But you got 2 new turbos, so.
I got 2 new turbos. Don't jinx me.
And right below that, you'll see that Commissioner Gaines, where you had asked about the communications piece of that.
Yeah.
And that 5232.
I noticed something earlier, backing up the list there, the insurance, group insurance has gone down, I think, on all your categories. Is that because we changed, and a lot of those folks changed over to that I can't remember if it was HMO or PMO or PEO, whichever. Did that,
Likely have to defer that question to human resources.
is that driven by that, or?
What we do is after we go through open enrollment, we use the
Okay.
actual amount of people's coverage. So that's what we put in the budget.
And it's still down from 19, and it's really close to 18, but could that be a function of those people moving over to that other?
Could be, yeah.
Okay.
That and being 4 to 6 short.
Yeah, well,
Well, we cover for that.
that
So we-
would be in there.
You cover for positions
Yeah, you have to,
at the minimum.
at the highest.
Okay.
Could be.
At the highest rate.
I think something else to consider that probably is a factor in there as well. When you start looking at some of those reduced costs on the insurance and retirement wise, I have a lot of men and women who work 2 full-time jobs. I'm not their only employer. So they may be working full-time in Forsyth and full-time with us. They may be working full-time in Cherokee and with us, Hall County, and vice versa. So they may be taking insurance
Somewhere else.
at one of their other employers and not with us.
And
as
you
well.
always have ups and downs in that in reference to the type of insurance that they're taking with us. If they are a single person and the person that they replaced was a family coverage person, then
Yeah.
you're looking at $7,000-8,000 difference right there off the bat. So where you've seen increases in other departments, that's because somebody may have been single and then the next person was a family person. And that raised that portion up as well. And we'll talk about some of those, obviously, in some of the other budgets, because that was really the only change in some budgets was insurance. And then the things that we had done in reference to salary and things like that. Okay, proceed.
So I think we covered the vehicle maintenance repair. Outside of that, I think pretty much the recommendations were pretty much in line. So no
Right.
significant really changes in the EMS budget. I think the big thing to talk about there now is kind of the 6 personnel for the.
Yeah,
fourth.
he has a request in for a 4th full-time med unit. That would require 6 people, obviously, if we decided to do that. Just for numbers, if you're writing them down in reference to his EMS budget, his request was about $63,000 less than what it was the year before, based on some salary changes and insurance changes and things such as that right there. But go ahead and explain your request in reference to a 4th med unit, personnel wise.
Dawson County has operated 3 full-time med units since 1998. During such time, Dawson County responded to 960 calls in the year 1998. Your population was just slightly under 15,000. If you break that down as call volume per med unit, roughly 320 calls per med unit. You have a population that's moving upwards of now 20,000. You're still operating the same 3 med units that you were 22 years ago. We're running approximately 4,000 calls. And if you break that down per call, per med unit, you're looking at 1,300 per med unit now. So you're looking at over a 200% increase. Obviously, as we grow, you all are faced oftentimes with various zonings that come before you, large developments. I think you all are constantly confronted with the growth and the challenges of growth that you have. But developing the infrastructure to prepare for that growth as we move forward hand in hand, I think is critical. Our current med unit average response time is 10 minutes and 20 seconds. The national average as determined by NFPA 1710 says that 8 minutes, 90% of the time. We're well below that. Death begins at 4 minutes to 6 minutes. And at 10 minutes, the chances of survival by the American heart for a sudden cardiac event are almost zero. Since 2018, Dawson County has added 968 single-family dwellings. This does not include the homes that are being built inside the city limits of Dawsonville. There's been 455 multi-unit apartments, multifamily dwellings added. 1,423 combined single-family, multifamily dwellings, a large assisted living facility going at Georgia 400 that will result in 70 double occupancy bedrooms, another 7 4-unit cottages resulting in 56 more additional bedrooms. And to put in perspective, the one that's next door to fire headquarters is a 54 single double occupancy. So you're looking at an assisted living that's going to be about 3 to 4 times the current size. We run about 86, 90 calls a year to the location next door. And why do I bring that to your attention? Well, when Med 2 goes out, located at Highway 53 and Tractor Supply, your next closest med unit to the chairman, to your home, comes from downtown Dawsonville. Over 115 times this year, we've been level 0. That means we have had no med units in service. The numbers I think I've provided to the chairman, they're probably a month ago. And I kind of, when I sent the email to the chairman and the county manager that same day, all those totals were wrong because we went level 0 twice that same shift. And we also used Med 3 and Med 7. One of the things to remind yourself when you use Med 3 and Med 7, we do keep reserve med units at both Station 3 and Station 7. You shut down the fire truck. So now you can go from having on duty 14 firefighters. If you send all the med units out of the county, you're down to 8. If you turn around and send Med 3 and Med 7 out of the county during the same time, you're down to 4 to cover the whole county. So it is critical. I know this is a heavy lift for you all, especially during our current COVID times, but I feel that if I don't bring it before you and provide you with the data that's needed to make these informed decisions, then I wouldn't be doing my job. Obviously, been here just shy of 3 years and have worked great with this board. You have done wonders for our men and women. I will tell you, the raises that we had mid-year in the salary study, we've experienced in 2020 some of our lowest attrition rates in the last 10 years. And so that's a good step in the right direction, and we're super excited about that. But that's just kind of some of the factual data there to provide you all. And like I said, we really need that 4th med unit to be able to provide a level of services to the community.
Do
I'll
we
answer
know
any
have you got
questions.
the number how many times we put up Med 7, Med 3?
What were they the last time we ran that? when the chairman had asked for it. I want to say we're probably about, if you combine both of them, probably about 30 responses from them. We've kind of backed off of that really based on daily staffing. If we've been down to one man on an engine across the county, we've elected to choose the mutual aid route and try to get a mutual aid med unit to keep our fire protection
Do
services.
you know how many
up.
times you've asked for mutual aid?
It's been what, upwards of about 30 to 40. Well, they go on mutual aid every time. Every time you go level 0, we put surrounding
I know
counties
that,
on
but I mean,
standby.
actually responded
An actual response to
Yeah.
the county is around 50.
50 times. Is that fire and EMS both?
Just EMS.
Just EMS.
Because that was a
Nothing to do with
question that
fire.
I had asked, I think that you hadn't got back to me on.
But last week we had a fire and I think we called mutual aid 3 times.
Well, and you're correct. We had a most recent structure fire up in the northwest area of the county. And unfortunately, the first in crews were, faced with a burn victim at that location. And they didn't even begin firefighting because their priority was treating the patient. So the first 3 people left the scene, headed to Grady with that patient. And the next arriving fire department apparatus were from downtown Dawsonville. Obviously, the addition of Station 8 will help with that. So that's critical. But again, we're not seeing a lot from volunteers. Volunteerism is down. Most people want to get paid for what they do. And I know for many years, we in the county have enjoyed a strong volunteer, but it's really a national issue as far as that goes.
So going back to, I know you said that we were at level 0. I think when you sent that to me 115 times at that particular point, you've had 2 or 3 or 4 or 5 since then. And then, so of those 125 times, let's say, now that you've been at level 0, you've had to put up med 3 or med 7. You said 30 or 40 times, and during that time frame, putting them up and responding, was that 30 or 40 times they actually went on a call too?
Yes,
As
that
well?
would be just responses.
Okay. And then 50 times you've asked for help from outside counties in reference to that. You and I had a discussion over the phone after I received your budget in reference to what I call peak time response. And so if you'll tell the board, what is the peak time for emergency services during the day?
Yes, so actually, Chief Dooley, the operations chief, I reached out to him pursuant to conversations that the chairman and I, and this actually kind of goes back to last year's request for personnel. And in that, I knew that the chairman and I had spoke a lot about that. Peak times, typically our busiest time period is Tuesday to Saturday, and the day of time is 10A to 10P.
The reason I asked that question is because if I figured if the board, was to look at that, then we could start out smaller than a full-time 24-hour a day, 7-day a week med unit, and look at some peak times, because peak times is obviously when you're going to run into some of these situations that they're running into where there are out of med units. I know we addressed that med unit issue in years past by ensuring that we had paramedic engines, and we spent a lot of money to raise those paramedic engines up to that, to make the care equal to what the med unit was providing just from that engine until the transport unit could show up. And I hope we're still able to do that with the care. So the care has not decreased. So it's the time response that we're looking at here in reference to that. But our care level, unless we've not got a person at that particular station that particular day, should be as equal to as it would be if that med unit showed up from that particular station that may not be there because they're on another call. Going back to the volume, in reference to EMS volume, where do we currently stand in reference to our no transport percentage? We used to be somewhere in that 45-50% range. Where are we at today?
I would say no transport. We're probably down now. I'm gonna probably estimate that in that 30 percentile. I will get
Can
you
you
a
get
hard
that for me?
number. I will
So
get
we
you
can
the
see what
hard
that
number.
is. And what that means is that truck's tied up for a short period of time, obviously, and then it's back in service. Another number I would like to have for the board, if you can provide it, and maybe 911 can provide this to you in reference to the times when you're at Operation Zero there, is what is the amount of time before you have that med unit back in service?
Yeah, and that's kind of
Before eight.
rolling. And just so you,
I know with 3 out, you're going to have some differences there. What's an average though? Is it 30 minutes, 45 minutes? That's something I know a transport's a 2-hour transport over there and back. But obviously unless you have a bad wreck, they're not all 3 leaving at the same time. So I'd like to know what that average is as well. Anybody got any other questions for the chief in reference to EMS?
I just want to mention I know when we did they did the budget, the audit, they showed that EMS collections were up 23%. They brought in another $300,000. And I think one reason they brought in more money because they've been running more calls, but it was up 23% last year. Which I think it was, wasn't it $300,000? I think it said on the budget. But I mean, EMS truck is just like a fire truck. I mean, it's a insurance. I mean, it's sometimes you look at the calls and the amount of calls they run, but you also look at, do you have a truck there when something happens? So it's like a fire truck. You're there in case something happens. Your insurance, and same way with EMS, you hope they're there when something happens to somebody. But I think the numbers on the city, you mentioned a little bit in the city, but I think we run about 40 to 45% to 50% of our calls out of Station 1 is city related.
Station 1 probably runs just around about the 40%. So Station 1's call volume, about 40% of it are in the city limits. I think it's critical to note that when Station 8 goes on board, AMP is in the city. And so they're going to benefit from that brand new fire station that will be less than 2 miles away from AMP. So I think it's critical to remember that, and when they have a fire in the city, and we have fires in the city every year, they get the benefit of all county apparatus throughout the county.
And I think when they get through with their rooftops, it's projected they're going to have close to 3,000 rooftops. So that 40% will probably go to about 60% or more.
Yep. And your average family households, based on the county websites, 2.97, and single person households, 2.61.
Chief, are we still running in the neighborhood of looking at national standards and stuff like that of where we're running 10, 12% of our population base? Is that still somewhere near the accurate number?
I would venture to say that it's probably just slightly higher than that now. And some of those contributing factors are the assisted living facilities.
Right.
They will generate more calls than your average single family dwelling. Multifamily dwellings also tend to generate a good bit of call volume for us. And the other thing to remember is you're starting to increase the number of hotels that you will be having here in the county. So you have a Holiday Inn Express, you have a Hampton Inn, and a Fairfield Inn. Holiday Inn Express will be soon to be opening, probably within the next few months. But you have 2 others that have already purchased land, submitted plans for review. So that 400 corridor is growing, and that's where we see a lot of that call volume is in that area.
What is the percentage of your overall volume that's EMS related? In other words, you run 3,500 calls. I know a fire truck goes with an ambulance on most calls. Of those 3,500 calls, what percentage of those are EMS?
We're probably staying about
Start
the
out.
national average.
82%? Okay. And I know when the first 2 or the 2 urgent care facilities went online, when I was still in the position you hold today, we picked up 200 calls the first year. So what are they doing to us now?
wearing us out.
What's the volume? Do you know?
We run a lot of calls at 108 Prominence and 81 North Side. And I know that the county's pushing to have more and more medical offices. Know when you increase that side of it, and it is good paying jobs, it is a good commercial base, but there's another side to it. There's sick people that go there. They're going there for a reason. They're sick. And at some point, they're going to engage our services. So yes, well, we do
I know,
run a lot of calls there.
I had a conversation with the CEO of Northeast Georgia Medical Center when they came over to discuss the hospital they're building now on 400, as well as some of the offices that they might build in our particular area. And I had that question for her, is because I know in my tenure of sitting in the chair you're sitting in, if you want to ride in the med unit, all you got to do is go to the urgent care and say, I'm having a little trouble breathing or my chest hurts. Regardless of whether it's a common cold or whatever, you're fixing to get an ambulance ride because that's all you got to say. And I had that conversation with her that they needed to do a little bit more in-depth study of these people that are coming in there, because everybody that comes in there and says those few words don't need an ambulance. Because I can tell you personally from taking my wife over there with an issue that did not require an ambulance, that I drove her myself, and as soon as we got in the door, they said, well, we need to send her by ambulance. And I said, no, I drove her over here. I can drive her the rest of the way. I thought y'all could handle minor stuff, but evidently at that particular time they could not, because they didn't even have what she needed. So there's some issues there, obviously, and I know there's been a lot of talk with them in reference to some of that stuff and trying to improve on that relationship and improve on what they provide through their urgent care facilities. And I guess that's still continuing.
We recently just had a meeting with the director at 81 Northside Urgent Care to speak exactly to that, because the flip side to that is you get the citizens who will then get transported by our service, and then they will call and complain if they get an ambulance bill, and they felt like they could drive themselves to the hospital, but the doctor staff and the nursing staff, and really I understand what the
Liability
physicians-
issue on
it's-
their part.
It boils down to a liability for them. They don't want to be on the hook for it no more than we want to be on the hook for it. And we're in the business of taking care of our citizens, and that's what we're going to do day in and day out. But there is that flip side of it that we do have to contend with. And yes, we do have meetings with both Northeast Georgia, Northside Forsyth. We've expressed to them that if it's a non-emergency, non-urgent, please, by all means, use a private EMS service. You're not hurting our feelings any. We're not here to compete with those services whatsoever. If it's a life-threatening emergency, by all means, dial 911. We're there for you. We're there for you. We'll do everything we can for you.
Okay. Any other questions reference to EMS?
Just comment wise, I'm by no means an expert, and I lean on Billy and Tim for guidance on a lot of these challenges that we have. But you continue to paint a very bleak picture with the services that we offer in that space. What would it cost to get you comfortable with our service delivery with what we have? I mean, how many units? I mean, what would be the most grandest thing to have where we have no issues in your opinion?
I'd give you my 5-year plan. Some of it's reflected in SPLOST 7. And in that, I would love to see Station 4 and 5 rebuilt and make them livable and staff them. We probably will not be long before I'll be back before you, and probably a few more years asking for a 5th med unit. Because as we increase, we're going to continue to develop our infrastructure with these multifamily dwellings. I know it's come up before. It'd be derelict if I didn't mention, but a ladder truck. Your closest ladder truck to this community right now is downtown Cumming. If that unit's on a call, it's McFarland. And right now we have apartments in this community that we just cannot serve, quite honestly. I can't protect them. And, it's a struggle. It's a struggle every day. To assign a dollar value, I can't assign a dollar value, but I can tell you, we should be looking to have every station in our county staffed with a minimum of 2 men or women on every fire truck, and preferably 3. Because if you can just envision pulling up at a fire, if it's myself and Chief Dooley and we're on engine one of us has got to pump the truck, and that leaves one person to go inside. And so from a safety standpoint, we preach, we teach at the basic firefighter level, all the way up, you operate in pairs. And that should be our goal, is to operate in pairs. If you look at 3 sides of the county that we're bordered on, Cherokee, Hall, and Forsyth, they're all running 3-man engine companies. And there's a reason why. It's because you can do 3 times the work. And you really want to start looking at savable property. What's your annual property loss versus what you could potentially save? And that's one aspect. But the one aspect that we look at day in and day out is lives. I'll burn a house to the ground if I can save an entire family.
Oh, yeah.
So, yeah, and I agree. So from just, let's narrow down to just med units, because we talk about how we have 0 in the county at certain times. Adding a 4th, how many times do you think that we would still be without, what do you call it, 0?
Level
Level
0.
zero.
Level 0. If we add another one, how many times will we still be at 0?
There will still be times. It's not uncommon for us to go to a car wreck that has 2 or 3 patients at it, and then have another med call drop during that same time. So right there, you take one car wreck, and that's 2 med units, 1 additional med call. That's all your med units. So yeah, are we still going to have periods of level 0? Yes, you will. But the end goal is to reduce that number of level 0 time periods. And I go back to the response time. You want to see your med unit response time go below 8 minutes, because that's where we're going to save more lives day in and day out, right there. That's the number that I hang my hat on every day. And that's the number I drive this guy nuts about. Every day when I walk by his office, where we sit, oh, Chief, I'm working on it. I'm working on it.
And the reason why we're above 8 is just locations and allocation of where they're physically located is
It is. I
one of the
mean,
main
so
reasons.
for those that are not aware, you have a med unit at Station 6 just outside the north gate of Big Canoe. Most of the territory there, right outside the front door, is inside Pickens County. You got 1,800 rooftops that are inside Big Canoe. The rest of that med unit's territory is 2,800 rooftops. We only run 10% of the calls inside of Big Canoe. The next closest med unit is here in town at Fire Headquarters, Med 1. And then the next one at 53 in Tractor Supply. And so, it's kind of, when calls go out, you're constantly moving med units and shuffling them to make it
Let me
work.
ask you this question, reference response time. What is our response time of actually putting a medically trained person on the scene? I'm not talking about the med unit, because we've got medically trained people on these engines.
Mhm.
So what are we actually putting someone who's capable of taking care of a patient? What is that time?
750.
So that's below the 8 minutes.
It is.
Okay.
And that's the critical part about when you start looking at staffing fire trucks. That's, a lot of people say, well, why'd the fire truck come to my med call? And it's because our men and women are certified in being able to deliver medical. Basically, all of our fire trucks have the capabilities of doing everything medical wise except taking you to the hospital.
Is that a requirement for the fire truck in the med unit? Because that's what I always see.
It's not. It's the community model that Dawson County has embraced. There are some fire departments that do just that. They're firefighters. They have nothing to do with EMS whatsoever. Some counties have separated fire and some have separated EMS, but the trend of the National Fire Service is to have that blended, because you get that dual purpose certified, and it really helps keep those costs down.
And what it does for us is it provides that care quicker.
Yeah.
Especially on EMS related calls, and then obviously being cross-trained EMS personnel, that provides the ability for our numbers to be up on the fire scene as well, because they can do both. Now, it cuts down that med unit, obviously, when we do that, but it in a dual role and trying to get the most bang for the buck for the taxpayer as well, plus provide the best service we possibly can for that money.
So let me follow up again. Sorry for my ignorance on all this, but so if we get a medically trained person under 7 minutes, they're at the same locations essentially that the med units are at. So why is there such a variance between?
Because you have 3 med units and 5 or 6 or 7, well, we got 7 stations right now.
You have 5 staff fire stations. When you
Okay,
open up
so
Station 8, you'll now
statistics.
have 6.
So
they're
you're getting
just
people
in
there
closer
quicker.
proximity.
Okay, so I know the sheriff's side, they have state patrol that comes in and handles like wrecks and things like that. So that helps augment and helps their staffing level to address those. You brought up the runs from like the immediate med locations. And again, I don't know, and I'm throwing this out there, and some people probably won't like it, but could we not contract with like whoever Central, I think Forsyth uses Central to handle just the immediate med calls that would free us up for all the other calls, or to help augment and supplement some of
I
that?
think that's a decision of the board. If that's the direction that the board would like us to take, obviously we can enter into some of that negotiations, but with it, you also have to understand there comes some challenges. Your EMS service here is probably one of the most progressive in the state of Georgia with the medical protocols that we have in place, the various medications that we have in place, the medical supplies. I would put our men and women against most in this state. We do things that most services are envious of. And that's a level of care that not everybody gets. And I can tell you that the citizens of Forsyth County do not get the same level of EMS treatment from Central. Central runs state minimum required medications, state minimum required. So if you enter into a contract, you're going to want to have the details of said contracts outlined very specifically, that you want them to have the ability to have some of these additional medications and these additional medical procedures to be able to provide same level of care consistently to all of our citizens and visitors.
But, in playing devil's advocate, none of that matters if we don't get to them before they're dead in 10 minutes. So, I'm trying to figure out a way to look at, I definitely am not suggesting that we get rid of any of our stuff. I say we continue to grow that, but how do we help offset some of the challenges that we currently have with some of these I won't say non-critical, but the immediate med calls or whatnot. So we don't get to level 0 at any time, because you have the best person riding on that thing, but if they don't get there within 8 minutes because we're all out of the county, then it does nobody any good. And I guess that's just my question.
Yeah, it'd be hard. I don't think they wouldn't come in unless they get it all. They're not going to come in and just say, we're going to sit a truck here and stay out here all day and be a backup in case y'all run out of it.
We don't set a truck there now, do we?
No, but I'm just talking about a private ambulance wouldn't come in here unless they get it all. In other words, they're not going to pay. They're not going to pay for putting a truck here to catch what we don't have.
Yeah, unless you're paying them big money.
Unless you're paying them big money. If you're paying them for not running calls or running calls, they're going to either want it all or, and like I said, then they don't have the same protocols we have.
Right. It's just, all I hear is the negative on our service delivery, but it seems like we got to think outside the box sometimes and figure out ways to address some of these more than 8 minute and the gaps of 0 most efficiently that we can. So I hear what you're saying.
And we've done some of that obviously over the years with what we've done in, making our engines paramedic style, to where those people are not suffering from lack of treatment until the transport vehicle gets there. And that's what it becomes if you get a paramedic engine on the scene, is basically they're waiting on the transport vehicle. Those 2 people that are there should be giving the quality of care that citizen deserves. And that's one of the reasons we've done what we've done and tried to make sure that those engines were, paramedic related. and that they could give those medications and stuff that we are proud that we can do, that our medical director allows us to do. I mean, you're looking at basically an emergency room on wheels, and these people are doing almost anything the doctor would do to you through contact with the doctor on the radio and stuff like that right there. So I think I want to see what that number is in reference to the amount of time in between some of those level zeros and what we're really looking at there in reference to that number. And going back to what I said before, the peak time hours is also an option that I think this board should take a serious look at, because we are not busy 124 hours out of the day. There are peak times. Same kind of conversations I've had with the sheriff on some of his requests is, what are the peak times? When are you seeing the majority of your volume and your calls and stuff like that? Because, you know, still people sleep in this county, thank God, and they don't stay up all night and cause ruckus on a regular basis. So any other questions for the chief in reference to EMS?
No, I think that, and you know, we talked about when you said how many it was short. I think the thing is to keep those paramedics too. We're short 3 paramedics, which could be.
Yeah, it doesn't do any
could be
good to
on that
add-
engine. Could be on that engine.
It goes back to
make an
what we've
ALS.
talked about a lot. I mean, we could add all the positions in the world, but if we can't fill them, we're no better off. Same thing we've talked about with the sheriff. I mean, every year we've talked about detention officers and stuff, and every year we start out with, we already have 6 openings that we can't fill. So I think Tim is right. We have to address the issue at hand, which is getting a full staff, maintaining a full staff, which helps us a whole lot. And I think Chief and I have had this discussion as well. And I'll be honest with you, we've approved over the years, and I've made some of this request to the board as well, for umpteen number of part-time positions. And you can have 25 of those, which we probably do. That's 25 uniforms. That's 25 sets of gear. That's 25 people that's got to be trained. And you get 1 day a month out of them. And you got all this money tied up in them. And Chief and I had this discussion too, is what does that translate into full-time people if we didn't have part-time people? I think he said 6. I believe that's what he told me at that particular time. So there's a lot of avenues that we can look at here as a board that would improve his quality of service, because what happens to you is, whether it's Chief Dooley or whoever it is that makes those 25 phone calls trying to find somebody to work, because this person called out sick at 6:45 and we're going to start at 7 o'clock with a new shift, and they run down this list trying to find some, because I know I've made those phone calls, and you'll call that entire list and not get a single soul, because they know when these other people work their full-time job somewhere else. So I start out with a 25 list that realistically is only probably 15, because 10 of them are working A shift, and guess what? Today's A shift. So those 10 are off the blocks right off the bat. You call the other 15, some of them are on vacation, some of them going fishing, some of them going this, and this. They already have a full-time job. Most of the time, what we call part-time is actually PRN, as needed kind of people, is basically what it boils down to. Now, it's not too hard to take the monthly schedule that they put together, and Chris is working A shift. He's going to take one of his vacation days. I can let Dooley, one of my part-time people, know 3 weeks in advance. Can you work for Chris on the 21st? He can probably put that in there, pencil that in there. It's when they call in the day of or 2 or 3 hours beforehand that you can't fill. And that's when you wind up with what they wind up with one person on a truck. In the future, we would be better off to have the full-time people, to where if everybody came in, he'd have 2 extra people or 3 extra people standing around that he could put somewhere. But if they didn't come in, then he still would be able to fill those gaps with those extra people. So there is a variety of ways to address the issues that we face, because you know, if he's only getting 1 day a month out of a part-timer, he's got a whole lot of money tied up in that person. And he's getting 24 hours worth of work. And unfortunately, with part-timers, and we went through this when I was in the emergency service as well, and Tim's very familiar with this. Somebody will work part-time long enough to buy the toy that they want to buy with that part-time money that they're getting. So they've got a motorcycle itch or a boat itch or something along that line. If that takes 6 months, then they'll work almost every day that you'll let them, so they can gather up that money and not take it out of their regular budget, or their wife may have told them that you ain't buying that boat with this money, you're gonna have to find another job. Because I've laughed at a lot of my guys in the past that say, oh, this is my motorcycle money, or this is my boat money, or this is this, that they're working. And then once they get to that point, good luck trying to get them to work again.
I like to call it keeping them hungry.
That's right.
Tell them you really need a new toy, because then you'll
All
get
right.
a little bit more work out of them.
Let's move on to EMA. There's not a lot of change in the emergency management budget request.
Just one, technical services.
Technical services is basically the main one, so go ahead with that.
So if you look at technical services there, that is crisis track disaster management software. Currently, just to kind of put in perspective, and I'll go back to Hurricane Irma. I came in at the tail end of Hurricane Irma. Most of that was from Chief Swafford at that time, but it was a declared event, and obviously was a lot of funding out there to be able to recoup. And so this is a program to aid us in better tracking debris management. A lot of that stuff kind of really falls over. While we may maintain the program side of it, it probably benefits McKee and a lot of them a lot more, because, you know, when they have that debris management side, we have a better tracking, and we're making sure that whatever we submit for a federal reimbursement, we're capitalizing every dollar. We're not leaving any money on the table. And I will say that the finance people here, great staff. I can't speak enough about them, and the ability to work with us and everything. But again, this is a program where the end user in the field, we can be in the field taking pictures of homes that have been destroyed from a tornado or something. And the program itself ties into your tax records. So it will populate it. It can be done from an iPhone, or it can be done from a tablet. But again, it just gives us a better assessment of damage assessment, dollar value, because that's one of the big things is when you have these weather-related events, and we always hear phone calls into the EMA office after a weather event, can I get some funding? Well, a couple things have to happen. One, it has to be a declared event. And then two, you have to trip your threshold for the county. There's a dollar threshold that we have to trip to be able to be
Per citizen,
eligible.
yeah.
That's right. To get some of that funding back. And so that's why I said, when we start doing these damage assessments in the field, it's critical for us to track. This is a program that we haven't had in the past. And I know the board has talked a lot about technology and everything and having it. And so this is just another avenue for the Office of EMA to have technology. I'll be honest with you, I hope I never have to use it. But again, it's something we're trying to use some of the current funding. We had some overages from actually Hurricane Irma that we're working with GEMA to get approval from FEMA to use and cover the initial upfront costs 1 year. That started just before COVID, and it's still kind of out there. And I imagine we probably won't hear from FEMA right now. It's called direct cost. But hopefully we can use some of that money to get us up and going for the very first year, and then just something that we add in every year annually, just as a maintenance side of it.
You know what the maintenance would be annually?
Let's see, Mr. Chairman, I may actually have brought that document over. Let's see, EMA budget. I think you can take out about $700. There's a $700 portion that they train the department or whoever we decide as to be a damage assessment. Let's see if that's it. Mr. Chairman, I did not bring it, and I do apologize.
That's fine. You can get that to us. How many devices would this software be on if you got this?
If it's compatible, then we can put that on there.
Well, a lot of
So it's
things
not
are-
a number of
A lot of things are
licenses.
license-based. There's no minimum
No, sir.
number
No,
that you
sir.
could put this on? Other questions for the chief? Reference to EMA.
So this weather siren maintenance, that's a big increase there. What's that?
Are we still paying for that out of the grant that we get every
Yeah,
year?
We use a portion of that from the EMPG grant. It's kind of a 50-50 offset. Something will be coming back before you here in the next couple of weeks to approve. But yes, we do use a
Has that
portion.
gone up any? Or-
It really
what we
depends. I think
get?
last year we had, 3 sirens that went down because of batteries. So we had a big maintenance cost last year. That it's kind of a revolving door. One year, yeah, and then we had one that got,
So 19, we actually spent over that. We spent $3,000, $3,100 in 19.
Spent, yeah. So that's an up and down depending on
It
whether
is.
they break down, and that's based on our 50% share
if
that
everything
we
goes
use,
well, it's
EMPG.
And they work
relatively.
off radios, and if the radios
There we
change,
go.
or
How many of those we got now? Eight. You hear that every Wednesday at a certain time if you're outside in certain areas.
11
Testing.
o'clock.
I don't think I do.
You don't, not at your house.
Just checking my hearing.
Yeah, yeah. All right, any other questions for the chief in reference to that? All right, any other questions at all for the chief before we let him go? I think we held him past his time, but appreciate the information.
Have we ever looked at volunteers to incentivize for volunteers like a property tax credit?
Not during my tenure.
You ever looked at that? I mean, a way to increase volunteers?
There's a money for volunteers,
Well, we pay them.
We do. We-
Fee,
Yeah.
but
Yeah.
$10 a call or
Association.
something like that, but yeah.
but it's not enough to.
Nothing to
It's not an
incentivize.
incentive.
to
we got about 3 now that's gonna cost.
Well,
Okay.
and the problem you run into nowadays, we're a lot different than it was back in the early days where you were more community-based than you are today, where everybody in your community was willing to take care of everybody in your community. You don't have that same mentality today. Another issue you have with volunteerism as well is Chief Dooley and Chief Thompson have to train that volunteer who might run 10 calls a year as well as he's going to train that guy he's paying. Because otherwise he's either going to risk that volunteer's life or he's going to risk the life of the people that he has in there with him. So they have to be equally trained, equally equipped. And so, we've had some excellent volunteers over the years, but that number has dwindled way down. And a lot of that dwindling way down has been due to the fact of all the other risks that's associated with being a firefighter. I mean, today, compared to 20 years ago, if you suck in the smoke from the couch that you sit on today, you're a dead person. Versus to 20 years ago, it wouldn't hurt you. So there's all kind of material out there that these people have to know and understand. And you wonder why they're still wearing their breathing apparatus 45 minutes after they put out the fire. That's the reason. They have to continue to wear that thing for their health and safety and the health and safety of the people around them.
What's the amount of hours now for just a basic firefighter and EMT a year?
So
And then the initial training, then
for
plus
the annual training just for fire certifications is $240. And then if they have EMS certifications, it can vary from 40 more hours for EMTs, another 60 for your medics. So you're well over 320 hours. And,
And all
for
that's
of our
part
that's just to keep
personnel.
your certification.
That's just to keep your certifications
To
up
get your
annually.
certification is probably up to 2 years, year and a half, 2 years now.
On the
Paramedic
so
it is.
EMTs,
Paramedic more.
well over a year, and the paramedic is closer to a year and a half, 18 months to,
That's a lot of time for a volunteer
2
to
years.
put in to get certified
I
and
don't see how you could really keep up.
Yeah.
No, it's hard to do.
Yeah.
Well, and the thing about it too is, we do a lot of our own training in-house, thank goodness. I mean, we have qualified people who have the ability to train our people down at Station 7 and at different stations. And that training is critical to our ISO rating as well, because if those people don't get that 240 hours, then we lose points that are associated with that, because they're going to come in when they do that ISO evaluation, they're going to ask the chief for those training records. And let's say Chief Dooley only has 180 of that 240. Well, whatever percentage of that is, that's however that calculates into points. And if you got 15 people that fall into that criteria, that goes back to our part-timers too. I mean, we've got to gather information from their primary service to our service so that we have all of those people numbers. So, and that, goes back to some of the things I talked about there of basically having our own crew so that we don't have to fight and scratch and dig for these certain things, because they have to make sure that these people are as qualified, even though they may work full-time for somewhere else. I mean, it's not uncommon for somebody to have let their certification lapse, and unless you're staying on top of the ball, you don't know that. And so a lot of times, I know Chief does this, and I'm sure Chief Dooley does the same. If he hires somebody, he can go on the website if they're a paramedic or EMT and check their number, make sure they're still active, that they have an active status, and that they've not been disqualified otherwise. Because I can remember years ago that county north of us had somebody that worked over a year, didn't have a certification, but they were treating people. So that's not what you want. So
Talk about a lot.
you got to be very careful and make sure you stay up on everything. Anything else for the chief before we move on? Thank you, sir. Appreciate it. Thank you, Chief Dooley. All right, let's move on to county administration. David, come on up. A little bit about his before he gets into it. His budget is not that far off from what the request was in 2020. I think most of it's in insurance is the increase there. Reason I wanted David to come, he's got a couple of requests for some rate increases, and also we talk about a full-time position, because we've had some discussions in the past on this board, and I've had some discussions individually with different ones of you in reference to our marshal's office, in reference to, we've got all these rules and regulations that we expect people to follow, and we got to have enough people out there to make sure they're doing it. And so he's going to talk about that a little bit today. So David, unless the board has a budget question for you in reference to your county administration budget, as I said, the only change to it's associated with insurance. And that's something that we can't do anything about. I would like for you to get into these rate increases that you've proposed, as well as this position.
Thank you, Chairman and Commissioners. Let me just start out by saying that I certainly know that, through our conversations that, as far as additional employees and increases and those kind of things, they're very, as the chief just mentioned, a heavy lift at times. And I know, especially in the times we're in now with the COVID and so forth and so on. But I bring these requests to you as a form of consideration for the board to consider and look at this in a broader sense, if you will, to Commissioner Gaines's point, the larger picture and where we are. And, we talk about this growth, and we talk about all these things that are going on, but our level of service stays about the same as we move along. And there's obvious reasons for that, and it's certainly understandable. And you've heard me mention before, that we do have staff that operate in several different areas. And so what I'm trying to do from an operational standpoint is to break that up and to begin to set a foundation for where we're headed, as we begin to grow. So one of those requests is that, as you know, James Talbert was the director of IT Well, IT under the facilities maintenance umbrella, it's just not really a, it's like oil and a water mix. However, I don't want to take anything, and I don't want the board to even begin to think that there was any issues there. But that creates a level of stress on somebody when their expertise is not in that area. Talbert did a fantastic job, and he had three fantastic IT folks working for him. So we've done very well with what we had. When we hired Herman Thompson, his background is specifically in that. He does a great job. He has a lot of respect from his coworkers, and he has come along. And you may recall just the other day, Hall County got hit, with the hack. And within minutes of us receiving that word, he and his staff moved forward in getting us backed up and all the things that we had to do to secure where we were right now. So what we did several months ago in 2020 was that we moved Talbert out from underneath of the IT directorship and moved Herman in that position. Along with that came a small stipend that had been given to Talbert during that time. So with that being said, what I'm looking to do is have the board consider bringing Herman Thompson up to a mid-range salary, which is on the salary study, and compared to what other counties are providing for directors of IT. As you know, that's a very specialized field that requires a strong salary. And we're very fortunate to have somebody with his talent and ability to be a part of this team that we have here. That increase is about $14,212. To go back to Commissioner Gaines' point and Commissioner Satterfield's point, as far as the salary study goes, if we don't look at this position and begin to bring that position into where that study may be, eventually we will. And eventually it'll be a large sum of money that will be paid out rather than just the $14,000 increase. So I'm requesting that the board consider that. And he has taken on additional responsibilities, again, as you know, with the new streamlining and the videoing that we're doing. Those types of things also require additional services from IT to be able to edit and do that kind of thing. So there are some additional duties that he'll be taking on. And as you've seen, we've actually advanced that program more than what it originally started out to be, when we had the public information position. So now as you can see, we're streamlining, we're doing videos, we're doing the Citizens Academy virtual. We're looking at Coffee with the County, which I'm sure all of you will be involved with as we go along further. But there's a lot of things that are going on kind of behind the scenes, I know my daughter, for example, will get in there and think that every time she turns the key, the car should start. But there's a lot behind that. And what we're seeing with the technology advancing and with what's going on now, we need to begin to start thinking about that down the road. Not to say that we haven't, but to be able to plan on those kinds of increases. So that my first request is the board's consideration to bring that director up to a mid-range salary for IT. My second request is to create the marshal's office. This has been something that we've talked about before, and I know, I believe Commissioner Nix was involved or on the board at that time when we had the marshal's office was actually separated, and I believe that Brandy Ransom was the original person that was over that department, and then he came back, and then Jeff Johnson, Sheriff Johnson, went over there, and then when we had the economy in disarray, we ended up bringing it back and sticking it underneath of planning and zoning. And as you know, planning and zoning is got a lot going on right now. Having that extra responsibility puts that individual, the director of that department, under, again, some additional stresses that he may not be familiar with and has to play catch up trying to monitor and control that department. The board has asked that we look at our ordinances. As you know, we're looking at ordinances every day. We're making modifications to those ordinances. And in some cases, it's created some situations where, well, we didn't do it in the past, but now why are we doing it? And so we need to have people that are trained and experienced in those areas. So what my request is to bring on or create this position back to where it was before, make it independent and put it underneath administration and take it out from underneath the planning and zoning. You can see in the report what those actual expenses are. And again, we'll address any questions there. My next request, and my third and final request, is that the board consider a slight increase to the public affairs officer, which the title has been changed in a sense that, again, we've gone from what the original concept was, and that was is to keep keep the public informed as best we could, to be able to work on programs that we can communicate better. I think was one of the Commissioner Gaines has always talked with us about in the board, is we've got to get better communication. I think we've done an outstanding job of doing that since this program took on, since it began, and it's morphed into more now because of COVID. That's where we're now doing a lot more than what we, I think, originally anticipated. So I was looking for a small increase of $2,300 and 87.52 to the public affairs officer. But those are my three requests, and would love to entertain any questions you may have in that area.
Questions for David?
Would you be the supervisor of the marshal?
Yes, ma'am. It would be underneath the administration.
IT request. Obviously, this changed since the last salary study, and so that kind of negates some of that. How much was a stipend that was removed from Talbert after he no longer does that
Is
position?
it 4,400, 4,800, some
48 annually?
Yes, sir.
And so, okay. It's really the difference is about $9,000. Okay. And then, does this change any of our relationship with our contract with, was it Appalachian Tech?
No, sir.
Still same amount of work
Same
and
amount of
everything?
people, same amount of work. I mean, they're still doing the same thing, although he brings a different expertise along there. They're looking at other areas to move into that I'm sure he can speak to when he does the IT.
Is our contract with them, is it hourly based or is it annually just set number?
It's an hourly based.
Okay.
They get.
County marshal situation, we have two right now, correct? Two and
Well, there's actually three now that we have an administrative person there. But you
Okay.
have one code enforcement officer and one animal control officer.
okay. And so would we look to, I mean, I think we have to promote from within for that role, or is it
Certainly,
just
everybody would be
completely
able to
different?
apply. That's correct. Yes, sir.
And we need a vehicle, need a gun.
That would be a mandated position, so therefore they would have the ability to carry a firearm. And they would be licensed to also assist in the sheriff's department if need be. But they would have arresting powers as well, which we don't have now.
We don't have that now with any of our guys. So, okay, so they wouldn't technically qualify for that as
Correct.
they sit because it's not post certified.
What would the office be?
Where Public Works used to be, over in the admin section, we have, since they've moved over to the new facility there, we have the office, both for the administration, the director, and the cubicles there for the code folks who are currently in cubicle sections.
So right now, none of them's mandated, so they can write a citation. They can't write a ticket or,
That's correct.
I mean, it's.
I think a lot of what you see reference to what they write are powers that they've been given from the board through ordinances that we have created that says this person, and this person has the ability to write a ticket and it goes to magistrate court. That's part of the ordinances that we have and that we put forward. One of the things, and this is one of the things that David and I discussed probably right off the bat when I became chairman, because we had all these ordinances out there that had penalty phases associated with those, but nobody was getting a penalty because we didn't really have anybody in place to do that. So we had a couple of people, but we were more of a complaint-driven service, which is not the way we should be. We should be actually out there knowing that we've got this developments that's going on around us and stuff like that, to where, you know, my thing to David was, and he's done a really good job of this, and now you see more and more stuff come through magistrate court for people are in violation on a regular monthly basis now, to where, you know, we went years of where they might write one ticket all year long. And we had this conversation, and I talked to David. I said, you know, our neighbor's doing 150 tickets a year. Not that I want somebody to get a ticket, and I'm very proud of our staff for being willing to work with people to come in compliance. But you get to a certain point where, when everybody knows that, well, they're not going to give me a ticket, and they also know that they'll give me this week, and then they'll give me another week, and then they'll give me another week, and then they'll give me another week to come into compliance, you get to a point where you just can't live that way. You know, if they come out to my house and they say, I got 7 days, I need to be doing it in them 7 days. And on the 8th day, if I hadn't done it, that's when I should get a ticket. And that's what we are now doing. And then, as you know, with the growth that we're experiencing and stuff like that, it is putting a burden on Jameson with all the other stuff that we've tasked him to do. So we need this to be separated. It should have already been separated. It needs to be separated now, to where there's someone that's just out there. That's what they're doing. They're out there making sure that all the ordinances that this group of commissioners and the previous group of commissioners have all adopted and set penalty phases to, and they can go around, you know, on a daily basis. And David and I talked about this, and he's got his guys doing this. If I get a call out to Chris's house and I drive by 3 developments on the way out there, after I get through taking care of Chris, I should stop by those 3 on my way back to see what's going on and make sure that the mud's not running out in the road or something's not going on that shouldn't be, instead of waiting for me to go back to the office and wait for somebody to call and say, Sharon's letting the mud run out in the road now. So we want to be on top of it, so it'll reduce the complaints. It'll keep people on their toes and doing it. And I think it's working. It's working now. People are understanding that they will now get a citation if they don't follow the guidelines.
Is it possible to roll this department out without hiring a new middle management person?
It's certainly possible. Yes, sir. I mean, that would just fall on me to, you know, take on that role, if you will. But then again, I'm obviously not mandated, so having that,
I know at one
that kind
time
of power.
we talked about, you know, we have fire inspectors that have some knowledge of this particular role, involved in ordinance violations as well. Is there still a possibility of a coexistence there, or someone who, you know, out of one of those 2 departments that could be the leadership of this particular department, that could do both of those jobs, to do their job and lead this job as well?
We'd have to look closer into that, but
Because they're already mandated.
they're already
Yeah.
mandated. Yeah, we already have a mandated officer there.
Okay.
Well, I think the thing in the past, like when I get, you know, a lot of stuff on 400, I get a call, and I call the county manager, and then we have to set up a meeting with Jameson, and it takes him away from what he's doing over there. So we spent a half a day, and I think we had something just come up that we spent more than half a day, and had the county attorney and some other department heads in there with us. But it took him away from everything he's doing in planning and zoning for a day or more.
Well, and to the chairman's point is that we do have, unfortunately, we do have some that are habitual, that continue to just wait until they get the warning. They get the warning, they have 30 days, because we try to obviously bring them into compliance before any ticketing is being issued. And so they know that because they're habitual, they know what's going on. And then they, in 30 days, they make a couple improvements and then they go right back to it again. And that, we do have those issues, and I think a strong enforcement, which you've seen already with the old shopping center there on 400. That's now been torn down there right before you get to old Grady there. And that was through the persistence of the administration there that, the ongoing discussions and enforcement of that. So,
But it took a lot of time.
Took a lot of time.
Jameson,
Yeah.
a lot of meetings, a lot
away
of time.
from
The other one
zoning
is-
issues and
Yeah.
things like that.
The other one is the nuisance abatement that we just passed. And then Jameson came before you the other day and we talked about getting permission from the board to go ahead and tear that home down. I mean, that's been in the process for almost a year and a half. And a lot of his time and his staff time has been repetitive in trying to get a hold of that landowner and be able to get this taken down. So there are several of those situations, and as we move forward and begin to grow, again, that department eventually will grow as well.
One other, okay.
These additional equipment requested, do you have anything now that this person could use, or is all this a total amount that we're gonna need, like the phone and the computer? Is there not a computer that they could use, or?
If we, and definitely would certainly look at that. This would just be outfitting them, and that's about the cost. But anything that we do have internally, and I would be speaking with Herman and them on that as far as what we can do to reduce that. But getting, what they have right now, this is where you would be. I mean, the vehicle, there may be a vehicle that we can take out of.
That's what I was wondering, I mean, this is lots of money.
Mhm.
So I was just thinking.
And that may be the compromise to that,
Yeah.
is to try to find another vehicle from another department, but
There's no doubt to me that this is needed. But then, then you keep seeing the cost pile on, and I just worry about that part. But, I want people to know if we do have these ordinances and these rules and regulations, that we mean business. And if one has to do it, the other has to do it. And if you've got a person that's targeted just for that, I think that's good. And that probably straightens some people up.
yeah, I wish I had brought that number with me. And my hat's off to Jameson and his crew for, and the chairman just spoke to it, that we've had much success in magistrate compared to what our previous years have been. And there may go a year where you didn't even write a ticket. We spent more time getting out of that than actually getting into it and letting the judicial system work. But since then, we've been very, very good at and successful at having them done.
More and more people, we're gonna have to let the hammer down on this stuff.
Well, and that comes more and
A lot
more-
of people tend to get wild, and
More and more pets
yes.
for animal control.
Well, now
So
that's wonderful. I'm
One-
for people having enough pets.
it's one of the things that we'll
But
look
they
at.
got to have them in the proper housing,
Proper place.
a proper place.
Well, one of the things that we'll have to look at, and I know the board's heard this before, and that is the fact that, we don't have after 5 or weekend, it falls on the sheriff. What we want to do is to put a rotation system in place to where we can handle those, and we have a mandated officer in there that can handle that on the off hours.
Weekends and nights.
Yes,
So that's where we get a lot of calls. I get a lot of calls from that area, 400, if something's going on the weekend or
Oh, really?
noise complaint at night.
Oh, really?
Too many cars on the road, parked, blocking the roads.
Mhm. Well, to your point, you and I had a conversation the other day about the 1 o'clock, 2 o'clock ATVs running, and we don't have anybody that really
Man, that's got to
can do
stop.
that. So we can get to the point where, we got the staffing or we've got the ability to rotate people in and out, at least on the weekend. That would help out a great deal.
Unfortunately, everything doesn't happen from 8 to 5.
Yes, ma'am.
It's true. One of the other departments we've talked to, or other roles we've talked about rolling out is GIS. Is there any, does that fall under you or does that fall under Jameson? or-
Under Jameson.
Okay,
Right
okay.
now.
I know that's where it is now, but has there been any, is he going to present that or is there?
It would stay there. They have a use for that. So right now it's a compatible use. So eventually, I think you're exactly right. It's something we need to look at. Right now, it's a manageable, part of that department. And it's something that department uses a great deal of.
Yeah.
So.
I just know that's going to become a big need as we roll into more and more technology. And as, we invested in that technology, the GIS software last year, I think it was. And so it's cross compatible with all departments, I think, as we move forward. So, okay.
And that's moved recently anyway from Public Works to.
Yeah.
That's correct.
Yeah.
To
And it's
his office.
been working well.
Where's work? Okay. Any other questions for David? Thank you, sir.
Yes, sir.
Clarify something. You were asking about the contract with Appalachia. There's really no contract because the Cameron and Will.
They're employees.
Okay.
That's how it's paid.
Yeah, they're county employees.
And Robin still?
Yeah.
She is, but I don't, Robin doesn't work for Appalachia right now.
Oh.
She's just strictly a.
Okay, okay.
Okay. Thank you. All right. Next up, we have IT. Herman, come on up.
Vicki, are they hourly or salary?
Looking at the information technology budget, you will see down in professional services that they've requesting an increase there. And that has a lot to do with our cybersecurity services that we put into place and that we want to make sure we keep into place so that we don't wind up like we did before. Increase in internet cost, that has to do, some of that has to do with the new fire station, and then also some travel expenses that they had requested for training for their staff that they had not had in the past in reference to that. They also have a request in for one full-time position, and I'll let Herman explain that in just a minute. But just for your knowledge, their request is approximately 28,000 plus above what they had in 2020. All right, Herman.
Okay, well, good morning. One common theme I've heard this morning is technology.
I thought it was
And,
more money.
Yeah, so every department so far has mentioned an increase in technology, and well, that's why I'm here. We do need, speaking to the new staff, I ran some numbers and got some numbers from neighboring counties to find out where exactly Dawson County stands as far as our number of IT staff to employee ratio. And as you can see on that sheet that I provided, if you have that in front of you, just to give you some examples, White County, for every 61 employees, there's one IT person. In Hall County Courts, okay, Hall County, which was mentioned earlier with regards to their hack, there's Hall County Government and there's Hall County Courts. Their court system actually has its own dedicated IT department. The court system IT department is 68-1. The national average is about 52 employees for every one IT person. That's based on the 75th percentile of entities around the same size as ours. Dawson County, we're at 159 employees for every one IT person. And as you can see, that's kind of out of whack. It means that our IT people work long hours. Our IT people handle multiple roles. Typically in an IT structure, you're going to have your network administrators, your system administrators, your technicians. In our department, because of the size of it and the number of employees and devices that we manage, we all do everything simply because we have to. And if one person is on vacation or out sick for some reason, it means those 3 that are remaining have to do even more. So we need to start bringing that ratio down so that we have, so that we can be more proactive instead of reactive. Because we don't ever want to be in a situation again like the hack that happened in 2018 and is happening right now in Hall County.
Do these other counties contract, I know we can't contract out substantial amount for cybersecurity. Are they doing the same thing or do they have in-house people that handle that?
They have in-house people that handle it for the most part. To give you an example, Hall County does not do the same type of cybersecurity that we now do. We have an actively monitored cybersecurity software that we use. They did not.
So by contracting out, we're actually one less person physically as an employee, but they're still doing the work of what these other ones are doing. So it's really not an apples to apples comparison when we discuss those numbers.
That could be said, yes.
Okay. But you like ours. I mean, you still, I'd rather contract it out than have somebody in-house.
Yes.
Okay. Obviously ours is working better than Hall's, right?
Knock on
Knock on
wood.
wood, yeah. Knock on wood. Okay.
We try and stay vigilant.
Okay.
Any
other questions in reference to that employee he's talking in reference to, IT coordinator?
I mean, in the budget, I mean, most of the increases are new facilities, public works fleet, fire station.
Yeah, I mean, like I said, you're seeing some
Most of it.
increases to our cybersecurity, which is something we need, internet, which is new facilities. And he's obviously wanting his people to have some education and training that they've not been able to do, obviously.
Correct.
And that's something we provide for all other departments. And so he's asking to do some of that very same thing.
And a lot of our training is expensive and it's not something that they've been able to take advantage of previously. And to stay up to date with cybersecurity and firewalls and all the different technology that we use, we need to have regular training.
That's why we have to buy new computers because it's changing. So if it's changing, the employee's got to change to
Yep.
get updated on everything.
Absolutely. And there's a lot of technology behind the scenes, behind those computers that has to stay updated.
Oh, without a doubt. Any other questions for him in reference to his budget or the person that he's asking for? Herman, go over the capital improvement items that you've got down in capital in reference to the courtrooms and phone upgrades and different things that you proposed in the 2021 budget of $420,000.
Okay, we did courtroom C last year. That was a great upgrade, as well as the assembly room here. Upgrading those from a purely analog system to digital. And I will say that I think the courts love what we did in courtroom C. We don't get nearly as many calls. They're using that courtroom more because of the upgrades that we did for it. Okay, so one of the things we need to do is go ahead and upgrade courtrooms A, B, and D to match what we did in courtroom C. Okay, that's one of the big items there. Also, monitor upgrades. Okay, we have upgraded the computers across the county. We just finished phase 3, the last phase this year. Okay, one thing we did not do is we did not replace monitors. Okay, a lot of our users are still using 19-inch square monitors. A larger monitor lets employees be more productive. Okay, and in some cases, dual monitors where it's applicable really helps with that productivity. And that's what it's all about. Okay, part of the IT's job is to see where we can introduce technology to improve productivity. And that's one area where we definitely need to upgrade. Okay, so that's one of the things in there. Also, our wireless upgrade. Okay, upgrading our wireless infrastructure. We have wireless in many parts of our different facilities. Okay, but in most cases, this wireless was put in a, hey, we need wireless in here. Can we put something in there? And we did so. Okay. it's not a true wireless, robust wireless infrastructure, okay, like you would typically see in an entity the size of Dawson County. Okay, so, and part of that is security for the wireless. Okay, so putting in a robust wireless network that can actually be used. Okay, and the last one that's in there, I believe, is phone upgrades. Many of our users are still using older telephones. We need to go ahead and upgrade those to some of the newer systems that have fewer problems.
Right, so I know one of the things we've talked about in reference to capital is obviously a lot of this is one-time purchase type stuff, and we're going to have some, hopefully have some cash that we can use on some of this one-time purchase. And also we've talked about in our Splosh 7 project that we've going to ask our voters to vote on coming up, that we put, you know, a larger sum of money for IT, so that we have learned the hard way that we need to be replacing stuff every year and not all at one time when it's become a major issue. And so hopefully, if we can take care of this immediate need through through some of the revenue that we hope to get through some of the sales and different things, then we'll be able to put the rest of it in Splosh going forward and have enough money in there on an annual basis so that they can do the job they need to do and to keep the equipment up that they need to keep up. And as you look throughout some of these budgets, you will see that departments ask for certain things, that monitors, different this, and maybe a computer here, a computer there. And I have made contact with those people and asked them that, you know, what they're asking for, make sure that they go through IT, because they're experts. And as we do with Shannon, I want to lean on Herman and his staff in reference to what's recommended for IT. That's going to be an IT project that they would have to put in anyway. So I want those people to have gone through them, make sure that they've made that request through them as well, so that they too are in agreement that they need that. And Herman and I had a conversation the other day about monitor upgrades, because I saw a lot of that as I looked through these budgets. And at that time, he had told me he'd put money in for monitor upgrades because he did know that there were some that needed to be. And so if we fund that with hopefully revenue that we hope to get, that and then we would lean on your expertise of who would be first in line and so forth and so forth and so forth on down through there.
Absolutely.
Any other questions for Herman?
I got a question, I guess, for clarification. I know we built this courthouse and courtrooms and all that. Is it our responsibility, or can the court system pay for any upgrades on computers and technology? Is that solely our responsibility?
They're all part of us.
Yeah.
I know, but I mean, you got circuit, we kind of split some on Hall County. I know they got judges come back and forth.
Well, we basically take care of our stuff over here. They take care of their stuff over there. We have a budget with them here. They have a budget with them over there. You know, I'm sure they intermingle some of their stuff and work back and forth, but
And we work with them. when
yeah, and they
issues-
talk back and forth, IT to
That was
IT.
just a question for clarification. I didn't know if there's any state funds, because I know state judges come in and
Well,
things
most
like
of
that.
that-
Is any,
Most of the state money that's coming to the circuit is for salaries and benefits and things such as that, because I ran those numbers after much chagrin trying to get those numbers from the state. Matter of fact, I had to call a state representative to actually get those numbers, but I finally did. Most of what they pay for is salary and benefits and things along those lines for people. And then the counties pick up most of the rest.
majority of it.
Yep. Those kind of things.
Just ask.
yes. Yep. Good question, though. Good question. Any other questions for Herman? Thank you, sir.
Thank you.
Appreciate that. Last but certainly not least is our Public Relations Department. Ms. Laura, come forward. In her department, she is going to be talking to you about an assistant, as well as some upgrades that she would like to make in her department as well. One of them is, I think, a $20,000 upgrade. And so, Ms. Laura, go ahead.
Thank you. Good morning. How are y'all? So starting off, yes, I am asking for a public affairs assistant. Since starting this position in January of 2019, the position has morphed into a lot more than just the simple public relations program that we had originally looked at. Since starting, we have implemented a video system slash AV system here in the assembly room. We have a new brand identity program that's rolling out. The Citizens Government Academy has gone from a in-person 10-week program to now we are doing it virtual on demand, which takes more time, it takes more resources. We had COVID-19, so we had all of those meetings and off-site things that needed to be taken into consideration as far as the website and news sections and information that needed to be distributed. The website has been redesigned over this past year. We've added additional social media platforms that we're trying to grow our awareness to the county and communications. Video editing for our Citizens Academy, our department videos, Patriots Day. You know, I handle all of those. Herman does assist me on some of those, but for the most part, I've taken that and I'm running with those. Zoom, newsletter, and then of course, with EMS, we've had a couple of our larger missing hiker incidents that takes me out of the office for several days. And being out of the office doesn't necessarily mean that the workload stops. It's still sitting there when I come back. You know, there's still other departments that need communication. There are, you know, you've got census programs that are going on. You've got recycling programs. All of that still needs to keep going even when we have these other incidents. So what I'm looking for in the assistant is to help me with those day-to-day operations, that they can take on and do some of the more in-house things as far as the social media is concerned, simple website updates that need to be done. Those sorts of items is what I'm really looking for. They can help me with brainstorming on new ideas for Citizens Government Academy. They can stay on top of some of the social media posts and what's most important to our citizens. So that's the majority of what I'm looking for on that position.
Okay. Any questions in reference to the position before we move on to the technical portion that she's asking for? You know, one of the things, and you know, unless you've been under a rock, you understand how much more information we are now putting out than we did prior to her coming on board. And one of the things that we heard over and over and over and over and over again, every time you turned around, was more communication, more communication, more communication. Well, we've greatly improved the amount of communication that we put out, whether anybody wants to believe that or not. We have. And I know she's looking to put out even more, and this helper, if she was to get that helper, would help her do that as well. So any questions in reference to that before we move on to the technical portion of change in her particular budget? Go ahead.
Okay. So for the professional services, I am asking for 20,000 on that. When we added the new computer system and camera system to this room, we did add 4 cameras. We've added new technology on this side that most people don't really see, but there's a whole system that goes on with the 4 cameras that we can switch in between. We can live stream on Facebook. We are also on Zoom. Well, with that, so we have new technology for that, but some of our older technology is not keeping up. For instance, we have a DSP that sits in the control room in the back that every time we have a power outage, or if it just goes down for a quick second, that system resets itself completely and we lose things over here. So we have to come in and reset and make sure that the system is actually working the way it should be. That in and of itself, that one piece is $5,300. Another thing that I've noticed throughout our meetings, and this is primarily due to COVID, we'll have people that will actually be speaking from the audience versus coming up here. Well, people that are watching remotely can't hear them. So unless they are actively at a microphone, our people at home are not really hearing the full conversation. So part of that would be to have microphones installed in the ceilings, as well as a potential for I want to say like an additional podium and microphone off to the side for when our directors need to come up and answer questions, that they are all still part of the conversation and everybody is being able to hear that. And so overall, that's around 20,000. That is working with WH Platts that came in to do the initial install of everything. And so that would just be, not only would it help here, but as well as some of the lavalier microphones, those could also be used off-site in regards to Citizens Academy, or if we have press conferences, things like that, we can utilize that over there as well.
Questions? Good job of explaining. No questions.
Thank you.
Thank you. That is our last department for today that we had scheduled. And as you can see, these were the ones that we asked to come, are the departments who had either personnel requests or significant capital requests, or significant changes to some line items in their particular budget. Tomorrow, we will have 1, 2, 3, 4, 5, 6 more for you to talk about and to talk with. I encourage you to continue to look at all the other departments that you have been given the information for. We will go over those as a group, and we'll go over some of those tomorrow that we haven't discussed. So I would ask you to, if you can, to prepare to stay a little bit longer tomorrow so we can kind of run over a few of those. And then we'll get the red raining if you have any particular questions. And I'd asked you before, and I'll continue to ask you, if you have any questions specifically of those departments, feel free to call them. I've called several of them with specific questions that I had after Vicki and Natalie and I sat down and discussed, and I put question marks beside certain things. And if they couldn't answer it, then I picked up the phone and I called them for them to answer it, because there were huge differences in some of the numbers that some of them had, even though it may not have changed their overall budget. Where they had moved things around. And so I found certain things like when I spoke to Elaine, I was used as an example, when I spoke to Elaine and tax assessor's office, they're now using our county attorneys. So, and they had put in $8,000 in their budget for attorneys. So and we pay that separately in a different way. So that's a change that will show her budget shrink down. But that was a question that I had because they had put in money for that in the year before. It's shown they'd spent like $700. So I called her to say, are you using the county attorney? She said, oh yeah, and we're very happy with them. So that is something that we can make a change to as we try to find other dollars for other things. I do appreciate everybody's coming, those that have listened to us online, as well as all the department heads, David, that have shown up today to be with us. And thank you, board, for your continuous diligence in coming to these budget meetings. I know they can be long and they make your head hurt because you worry about the dollars and the numbers that are associated with those, but it is our one of our primary responsibilities as a board is to determine a balanced budget. And we will get to that between now and the end of the year, because that is something that we have to do and provide the quality of service that our citizens need. And with that, unless you have something else, board, we will be adjourned till tomorrow.